I'm Stadshaug with Kitsap Physical Therapy, and this is my guest Jackie. This is part 2 of us following with Jackie through her journey of diagnosis and cancer treatments. So Jackie, I'd like you to tell us a little bit about the medical treatments that you first had with your oncology team, and then how that tapered into a cancer rehab program for you afterwards.
So I ended up having a hemithyroidectomy first to remove the primary tumor.
Hemithyroidectomy means
half of my thyroid removed. So I initially had the right half of my thyroid removed, along with 11 or 13, now I don't remember, lymph nodes. And in this, they also removed some suspicious tissue from behind my thyroid, which turned out to be a secondary large extrathyroidal mass. So it was a mass behind the thyroid that was actually concerning to them. So.
And the lymph nodes were taken because they were trying to see if there were cancer cells outside of the primary tumor, correct?
So they actually, in surgery, discovered that there was one or two, I don't remember. There ended up being 2, but I don't remember if it was 1 or 2 during surgery that actually did contain a tumor. And so as a result, they ended up, instead of taking the original 4 planned, taking 11. So, yeah.
And part of having lymph nodes removed can affect you on the other side of surgery because one, lymph nodes are part of your immune system, which is why they're picked up, or cancer cells can be picked up by the lymph nodes. But it's also important as far as your plumbing system, right? Outside of our main plumbing that we know of with arteries and veins, the lymphatic system is kind of like the overflow system for your plumbing, right?
Yes. And so I know as a result, you and I actually talked and worked together on trying to help with my swelling management because I had post-op swelling with both surgeries. So I ended up having a second surgery also to complete the removal of my thyroid related to the extra tumors I ended up finding, and with some suspicious looking, they were like, let's just do it. And so you and I had conversations leading into that about what I needed to be doing for the swelling management the second go round. So
yeah, and swelling after surgery is completely normal. It's just when we were starting to detect it, it was lingering on a little bit longer than we would expect it to be. And how can, from a rehab side, we facilitate that process? Because I know you're having some difficulties with range of motion and even swallowing and talking, and so that's where we said, okay, maybe let's get you started on a post-operative cancer rehab program. So that's where then you got matched up with my colleague Ron.
Yes. And so Ron and I initially worked, I had a lot of muscle just tension and guarding secondary to the surgery, and the surgery being in the neck. And then what we also discovered was I had some scar-related immobility restriction, and so we ended up needing to work on both my musculature as far as relaxing it and actually help strengthening it again because it got weak, and also working on some of the mobility issues related to just the scar, related to just how I can move my neck, and then also, like you said, the swallowing that was part of that as well. So
perfect. So that kind of wraps up this portion of it, because then we'll start to hear about how after Jackie was starting to feel better and a little bit more of that energy back, that we talked about getting her involved in a group exercise program to build up her stamina back again. Thank you.
Thanks.